When we think about head and neck cancer and the underlying biology, we have to consider that there are really two now distinct etiologies that we recognize. The traditional one of carcinogen-induced, tobacco-related head and neck cancer, of course now being referred to as HPV negative, is one that is characterized by a slightly higher mutational burden. Those mutations tend to be in tumor suppressor genes like P53 and P16, FAT1. It tends to be more aggressive. It tends to be less responsive to therapy. And the prognosis, unfortunately, is worse with the carcinogen-induced or tobacco-induced head and neck cancer. The converse of virally induced, and that is human papillomavirus or HPV, now is driven by that virus, primarily by the viral genes of E6, E7, but not exclusively. We're recognizing that the other viral genes also play an important role in the etiology. We also recognize that it has also an appreciable mutational burden, but not as high as the HPV negatives. However, because it's virally induced, we often see a robust immune infiltrate characterized often by T cells and macrophages. HPV positive cancers tend to have a better prognosis, they tend to respond better to therapy, and they have a higher cure rate.
We have two very different kinds of head and neck cancers biologically, and immune checkpoint inhibitors seem to work in both of them. Why? Well, one of these subtypes are the smoking-driven head and neck cancers. These are cancers with high mutational burdens, high neoantigen burdens, very immunogenic. Some biologically have used the word inflamed to describe them. These are very inflammatory cancers. A lot going on, very mucked up, perturbed milieu, scientifically high degree of interferon gamma signaling going on there. That's more like the melanoma example of the high mutational burden, high neoantigen, and the checkpoint inhibitors certainly work there. What about the other half? The other half, or other portion I should say, are the virally driven cancers, particularly the HPV-driven oropharynx cancers. And here, it's notable that this is a virally induced cancer. By its nature, a virally infected cell is going to have certain neoantigens. Our immune system exists in everyday life to fight infections. And so there's activity there as well. And so you have two very different biologic groups that seem to both have efficacy of the drugs. Both of these subtypes are T-cell invaded.
When we further look at HPV positive cancers and we begin to ask questions around the tumor microenvironment, especially with respect to immune markers, we quickly recognize that most actually, HPV positive cancers express high levels of PD-L1. That expression can be on tumor cells or it can be on the tumor infiltrating immune cells, especially macrophages. About 2/3 to even 3/4 of HPV positive cancers will have some degree of expression of PD-L1, suggesting that they may be good candidates for therapy with PD-L1 or PD-1 antibodies.